My name is Eric Okoth, a physiotherapist by profession, partnering with the Ponea Health. So today we learn to discuss the activities that take place during a physiotherapy session from the point patient enters the clinic to the point the patient now leaves. So there are about, I can say, about 4 stages of or activities that a patient will have to undergo in a single physiotherapy session. So first is the clacking. In the clacking is where now the patient you get to find the details of the patient, the history of the patient's condition. When did you first have the symptom you are experiencing? What elicited or what caused the problem that you are experiencing? Or if it is something that you think could be hereditary, you try to find out, is there any person that you may know of in your lineage that has suffered or is suffering from the same problem that you are encountering. But that may not also be so needful in cases of a patient who has a trauma or just an accidental injuries. So once the physiotherapist has taken all that detailed information about the patient, now we move to a stage 2 or a second procedure, which now we are going to do an assessment to evaluate the cause of the patient's problem. So this one now will do series of tests based on the problem the patient is presenting with. For example, I may say maybe a patient who is presenting with a pain on the knee, or maybe a limited range of motion of the knee. So in that case, you'll try to find out what is causing the pain on the knee, or what is causing the limited range of motion of the knee. Or then you also find or to rule out, is there soft tissue involvements, is there ligaments involvements, or is there rupture, strain, or such, or is that tendon that is interfered with. So in there you do specific movements depending on what you are trying to find out. So when you'll need to immobilize or to restrict some movements so that you find to address a specific muscle to find out, is it the cause of the limit range of motion, or if it is the ligaments, you do the action of that specific ligament to find out, is it painful. So wherever you find pain with a specific exercise or a specific movement that is aided by a specific muscle or ligament, then basically that ligament or that muscle is injured. From there, you now find out what kind of injury. Is it to this muscle? Is it a strain? Is it a tear? Or what could it be? So in cases where the patient, the physiotherapist is now not so certain of whether, or suspects that it could be a severe injury, maybe a tear or some other things, that's where when the physiotherapist find that it is a severe or a muscle tear, for instance, that may need a further tests to rule out. So the patient may be referred for an imaging. Thank you so much for joining us in this discussion. We are looking forward to engaging you and interacting you a lot in our future episodes. And you can book my services at poneahealth.com.